welcome back to the broadcast. Stroke can affect anyone at virtually any age. In fact, every 40 seconds, a stroke hits someone in the U.S., and that's why there's now something called the Stroke Summit that's making its way across 12 cities in the U.S., raising awareness about this condition. Welcome to our show, Dr. Lee Price. Good morning. It's good to have you here, all the way from UT Southwestern.
Yeah, thanks for having me. I really appreciate it.
Let's go right into this summit that you've been part of.
Sure. So the Stroke Summit has been organized by the Society of Neurointerventional Surgery, which is an organization, it's a national organization of stroke practitioners who practice a type of intervention for acute stroke. And it's really designed to raise awareness and enhance physician communication across the country to try and bring better outcomes to our patients. And we just had it about a week and a half ago here in Dallas.
And is it open to the public? Is this something that will be ongoing, not in Dallas, but in other cities? Is that right?
It's in other cities, and what it's designed to do is really to bring in primary care practitioners and emergency room physicians and neurologists and neurointerventionists and neurosurgeons, everyone who's involved in stroke, to try and help us communicate better, talk about things that work best, and improve the real mechanisms that we use to treat stroke.
All right, let's talk to the viewer and let's give them some good tips on how to recognize a stroke coming on.
Well, sure. There's actually a mnemonic that people use. It's called FAST, and F stands for face, A stands for arm, S stands for speech, and T stands for time. So if you've got face weakness or a drooping face, arm weakness, and speech trouble, it's time to call 911. It's time to go to the ER, because that's a really high chance you're having a stroke, and we can act if we act quickly.
Now, is a stroke something that could be preventable?
Yes, strokes can be prevented really by controlling some risk factors like diabetes and hypertension and hypercholesterolemia. So going to your primary care doctor and keeping on top of those risk factors and keeping those things treated is really the best way to prevent stroke. And aspirin, when you're of a certain age, is pretty effective in preventing stroke.
I was going to ask you that. I remember my grandmother always taking an aspirin. What age do you recommend for that?
Oh, you know, I'm 50 and I've started taking aspirin, so I take a baby aspirin a day. I'd say maybe 45 or 50. A lot of doctors might feel that way, that that's a good time to start taking aspirin.
My husband's pushing 50, and I think he just started the little Bayer aspirin himself.
Yeah.
So that's right about the same age.
Yeah, that's about the time to start.
Tell me, I know that oftentimes a stroke can lead with paralysis. Is that something that somebody can get therapy to recover from? Is it permanent or not?
Yes, there's a couple of things with stroke. So when you present with paralysis, if we can act in time, sometimes we can reverse that with medications or interventional treatments if we can act within a few hours in select patients. And then if we don't act in time, or if the patient doesn't present in time, then they have permanent weakness that is always helped with rehabilitation. It's just a matter of how much they get back. Some patients get back more than others, but rehabilitation is critical, and that really helps.
Do you have to maintain the rehabilitation? Because I was speaking with someone earlier this morning, and he said that he knew someone who had the paralysis, went through rehabilitation, it left, but then the paralysis came back. So is it something you have to maintain? Usually
the improvement happens over 6 months to a year, and after 6 months to a year, you stabilize out, and more rehabilitation doesn't help that much. And it may be that there was something else going on. We see stroke patients who will get an infection, and it will cause their previous weakness to worsen temporarily. So that it might be something else that was contributing to that.
Well, you brought a really cool gadget that I would love for you to show everybody if we can. We have just a short amount of time, but I was really fascinated with this thing. What is this?
So this is just one of the latest devices that's used to treat acute stroke, and it's one of the things that people in my specialty do and use. So an acute stroke can be caused by a clot blocking a blood vessel in the brain. And this is just a device that's designed to remove that clot. And it's just a small little kind of a basket-like device. This one's called the Solitaire device. And I don't know if you can see that.
Yeah, we need to get our camera really close on this. This is really fascinating.
But it's delivered
what's happening here?
It's delivered through a very small tube.
Yes, there it is. You can see now.
And it comes out inside the clot, and it just entangles the clot with this very fine metallic device. And then you gently retract the clot out of the blood vessel. And this device has really dramatically changed some of our acute treatment of stroke because of how quickly it can remove clot and how efficiently it can remove clot. So what used to take hours to get clot out now takes minutes.
That's
and it's really
it's
exciting.
Like a good little roto-rooter. Just clean you out.
Exactly.
Thank you so much, Dr. Pry, for being here. And we appreciate all your information and everything that you do to help everybody stay well.
Okay, appreciate you having me.
If you'd like to get more details about the Stroke Summit, just head over to our website, thebroadcasttv.com, and then click on today's links. When the broadcast returns, we're in the Sub-Zero Wolf Bentwood kitchen with a creative recipe that'll make your Valentine feel like royalty. We'll be right back.